Today we will study the Guasha therapy of Chinese medicine. Guasha can be traced back to the Paleolithic period. In the early times, flat stones were used to perform stabbing, picking, rubbing, flapping, and scraping. Flat stones are still used today. However, with the development of acupuncture, flat stones are used differently. Guasha is a new therapy combining acupuncture with the use of flat stones. Together, it is a new therapy. It is widely used. Especially for the treatment of acute disorders. It not only brings good results in a clinic, but is also easily performed. Not only is it used in hospitals, but it is also very popular in the community. In a clinic, Guasha therapy is significant and has a close relationship with Chinese medical theory. The practice of Guasha is on meridian and acupoint. Meridian is part of the acupuncture theory of Chinese medicine. But in Guasha, meridian and acupoint are a must. Meridian consists of channels and collaterals. Channels refer to the trunk line, while collaterals refer to branches. Channels include 12 channels and 8 extra channels. While the 12 channels refer to 12 trunk meridian lines, according to yin-yang theory, meridian line is classified by yin channels and yang channels. The 12 channels are composed of 6 channels in the hand and 6 channels in the foot. The channels in the arms are called 6-arm channels. The channels in the leg are called the 6-leg channels. Meridian lines in the arms are composed of hand yang channels and hand yin channels. The channels in the inner side of the arm are called 3-hand yin channels, while the channels on the outer side of the arm are called 3-hand yang channels. As for foot leg channels, the channels that are on the outer side of the leg are called 3-foot yang channels. And those on the inner side of the leg and on the breast and abdomen are called 3-foot yin channels. Because the 12 channels connect different parts of the body, those linking to the skin are called 12 skin parts, and those linking to the tendon are called the 12 tendon parts. Besides, there are 8 extra channels. They are the channels of Ren, Du, Chong, Tiao, Dai, Yin Tiao, and Yang Tiao. Altogether, there are 8 of them. Collaterals include 15 collaterals and some sub-branch channels. They are used widely in clinics. Then comes the acupoints, which are important points when practicing Guasha. They are composed of 3 parts. One is in channels. For example, the 12 channels and Ren channel and Du channel in 8 extra channels. Those acupoints in the 14 channels are called meridian points. The second part are those not included in the 14 channels, but which are very important in clinics and are called extra points. The third part is ashi point, which is the responding point of the disorder. For instance, the responding points for a person with a fever are on the back or legs. There are some maculas or knots. They are ashi points. Another example is if one has got a stomach ache. There are pain points on the back if pressed. Some patients with cholecystitis have pain points on their backs. They are all ashi points. So when practicing Guasha in clinic, one should find out the responsive channels and points. The points are meridian points, extra points, and ashi points. One should also know Guasha techniques, meaning how to practice Guasha therapy on these points. Guasha therapy has especially good therapeutic effects for acute disorders. So when Guasha is used in a clinic, the important thing is to select the points and know the operating techniques as well as the related disorders. Guasha can be widely used in the treatment of disorders. In internal medicine, surgery, gynecology, and pediatrics, and is especially good for healing complicated disorders in internal medicine. Beauty, acne, and the intercession of incretion. Acupoints have close relation with Guasha therapy. Channel here means bladder channel. Bladder channel starts from the eyes. Then goes to the back of the head through the top of the head. And neck to back and hip. Then to the rear side of the legs. And finally to the outside of foot. Why does this channel have a close relation to Guasha? Because there are many excited points used in Guasha. Most excited points are the ones on the bladder channel. In this channel, the point on the back is very important. It is at 1.5 chun beside the right middle line. First, find the blade bone. Touch its inner round. The distance between the inner round and the middle line is 3 chun. The middle point of which is 1.5 chun. Channel points are all along this line. Practicing Guasha on this line can cure many disorders. So bladder channel is very important for Guasha. This is what we should master. Another important channel is Du channel, which goes along the middle line of the back and waist. It starts from womb, then goes to anus. To the waist and back, and then to the middle point of the head, and to the middle point between two eyes to the tip of the nose, and finally to the lips. There are many points in Du channel for practicing Guasha. To cure lots of complicated disorders. For instance, having a fever. One of the points for Guasha is Dazwa point. It is in the lower edge of the seventh neck vertebra. Practicing Guasha on Dazwa point can relieve heat. It is widely used. Furthermore, Ren channel, that is opposite to Du channel, in the middle of the breast and abdomen. It starts from the inner side of uterine to the mouth and lip through the breast and abdomen. In clinic, both Ren channel and Du channel go together. They bring ideal effects for treatment, say in gynecology. In Chinese medicine, the health of Ren channel directly affects the health of a woman. If a woman's qi and blood of Ren channel are flourishing, she can keep good health of body and mind. Reversely, if her Ren channel is dysfunctional, she may get many complicated disorders of gynecology. Another example is the syndrome of menopause, which is closely related to the rise and fall of Ren channel. Therefore, treatment of the Ren channel will bring good therapeutic effects. Then comes 3-foot yin channels, which go in breast and abdomen, and in the inner sides of the legs. They are important for treating the disorder of internal organs. These should be mastered. As for acupoints, in clinic, there are 4 ways to select points. One is bone measurement. Which means selecting of points depends on people's height. For example, from the horizontal line of the elbow to the horizontal line of wrist on one's arms. The total length is different because people have different heights. But in Chinese medicine, it's all 12 cun. The shorter people are given short cun, while the taller people are given long cun. It's all divided evenly. Each person has his own cun. This way is fixed. For instance, the distance from horizontal line of elbow to horizontal line of wrist is 12 cun. The distance between 2 nipples is 8 cun. So it is 8 cun between 2 temples. It's 5 cun from the navel to pubis. These are fixed. It is helpful to select a correct point. It is widely used in the clinic. The second method is body sign, which has two parts. One are the signs that can be seen clearly when the body is still, such as the nose, eyes, ears, and nipples. Say, Tan's Hong point is in the middle point between the two nipples. Another example is Shenjua point, which is in the middle of the navel. They are clear signs. The other signs can be seen by some specific motion. It means different motions display different signs. Say the horizontal line of the elbow, which can only be seen clearly when the arms are bending. They cannot be seen clearly unless one does some movements. The third is to select a point by the finger measurement. Say the thumb refers to Wan Chun. Take Nai Guan point, for example. It is the point of Tu Chun up to the horizontal line of wrist. It can also be measured by the thumb. Furthermore, regarding four fingers as 3 chun, it is also known as one finger method. If the index finger bends, 2 lines appear, which link upward. This is to measure with the index finger, and also called finger sun method. The fourth method is easy to get. For example, to select Lai Kuei point in lung channel. After crossing 2 hands, one may find the part that the index fingers touches is called Li Kuei point. These are ways for choosing points. When Guasha is practiced, the following points are used. One is Ba Hui point, which is on the top of the head. When selecting, one may fold and lift the ears. Then link 2 fingers, and the middle part is Ba Hui point. It is a commonly used point on the top of the head. Another is Feng Shi point, which is in the outside of the trapezius muscle behind the neck. It is in the concave part. This is a commonly used point in the neck. Others are like Bei Shu point on the back. Three-hand yin channels are in the arms. 3-foot yin channels are in the legs. We will explain it later. In clinic, there are many scrapers for guasha. In terms of materials, scrapers are made of cattle horn and jade. According to the difference of the parts in times for guasha, guasha scrapers are commonly used and are easily used. on many parts, such as the front body, limbs, 3-hand yang channels, and 3-hand yin channels. Then Guasha comb comes. It is used to cure discomfort on the head. Frequently using Guasha comb makes people live longer and improve their hair quality. It is easily used, for there are many points on the head. Such as yang channels, bladder channel of the 3-foot yang channels, Du channel, Xiaoyang channel, Yangming channel, and so on. So it is very popular. The other is Guasha pin. Guasha yu, fish, also gives good feeling and effects. This is jade that has a special characteristic of Chinese culture. So, in the course of treating disorder, combining jade's character in Guasha therapy may treat disorders effectively. It functions more than Guasha therapy. We also know its material quality and other functions. They are affected by the quality of jade. In order to make an easy guasha, guasha oil is also used. For example, use some oil on the parts for an easy guasha. All of these are common guasha equipment. According to different disorders and different parts, you can choose different tools. Next, I will talk about basic operations. It depends on the body parts and the structure of the body. On the head, take the Ba Hui point as a key part for practicing guasha. Fold your ears forward, then lift upward, then go to the top of the head, and this point is Ba Hui point. Si Shang Chong points are circling Ba Hui point in 4 directions, each being 1 chen apart. When scraping, one may scrape along Ba Hui point towards the left, forward, right, and backward. In this way, disorder on the head can be cured, such as dizziness, sequela of brain blood vessels, and insomnia. Scraping inward to the Ba Hui point can cure migraines. These are scraping methods on the head. Ba Hui point and Si Shang Chong points are the key points. These are scraping methods on the head in clinics. Furthermore, scrape the neck. Fing Qi point, for example, which lies on the outside round of trapezius muscle, is the point of gallbladder channel. Then, Feng Fu point is the point in Du channel. Scrape these points downward in 12 parts on the neck. In this way, discomforts in the neck and head can be cured. This is a commonly used method on the neck. Now, the scraping method on the waist and back. This is very simple. One is Du channel. Which is in the middle of the waist and back, and the other is bladder channel. There are two lines. One is 1.5 chun from the middle, and there are 4 in all. Scrape along Du channel, then scrape along bladder channel. They are widely used in the clinic. It can cure lots of disorders. In addition to the disorder on waist and back, some disorders belonging to internal medicine can also be cured on waist and back. Next is scraping on the bottom of the waist. Scrape upward from the bottom. In fact, it is an upside-down triangle. First, scrape Du channel, then scrape outward. Outward slantwise. Scrape in a shape of upside-down triangle. This is scraping on the bottom of the waist. Next is scraping method on breast and abdomen. Scrape Tanshong point first. Downward, then outward. This part is used to cure disorders in heart blood vessels, as well as the disorder of respiratory system, such as coronary heart disorder, cough, and shortness of breath. Tanshong point is helpful. Next comes abdomen. Scrape along Ren channel, stomach channel, and spleen channel. There are key points. Next is to scrape joints. Generally, scrape the inner side of joints, then outer side of joints. They are helpful to cure joints disorder. Then scrape the inner side of the arms, 3-hand yin channels in particular. In Chinese medicine, the outer side of the arms is lung channel of hand Tai-yin. The middle is pericardium channel of hand Ju-yin. Different channels can be selected for different disorders. For insomnia, you may scrape the heart channel of the hand Xiaoyin. If one feels stuffy in the chest, you may scrape pericardium channel of hand Juin. It is very widely used. Furthermore, scrape along channels in the legs is the same. Different Guasha therapies should be used for different disorders. The first special method is to scrape Si Shang Chang method. It is used to cure disorders of the head. After selecting Si Shang Chang point, you may scrape it forward, backward, to the left, and to the right. Scrape gently. So that the patient can bear with it, for the head is sensitive. Scrape the temple at the same time. It brings good results to people who suffer from migraine. Scrape from Si Shang Chang towards the temple. Headache can be relieved. The second is to scrape on the side of the head. Scrape from Ba Hui point towards the temple, towards Tao Wei point, which is at 0.5 chun up the temple. Scrape from Tao Wei point towards the temple. Migraine can be cured. The third is to scrape the temple. That is to scrape from the temple towards Feng Qi point. Scrape along the gallbladder channel. For treatment of dizziness and headache, good results can be achieved. Next is to scrape the 3 neck lines. It is used to cure disorders in the neck vertebra. Scrape from Feng Fu point along Du channel. Another is from Feng Fu point to Jianjing points. Jianjing point is the middle point between Das Hui point and shoulder peak. 3 neck lines method is from Feng Qi point towards Jianjing points. It is used to cure disorders in neck vertebra, pain in shoulders and back, inflammation of muscle membrane. It is often used in clinics. The other is the 3 back lines for treating disorders in internal medicine. Du channel and bladder channel can be used, with good effects in internal medicine disorders. Another is to scrape nip spine point. In acupuncture therapy, there is a special extra point, that is nip spine point. It is on both sides between breast vertebra and waist vertebra. People believe it was discovered by Hua Tuo. So it is also known as Hua Tuo nip spine. From the first breast vertebra to the 5th waist vertebra, 0.5 chun beside the spiny part is Hua Tuo nip spine point. This method is to scrape along the nip spine point. It is widely used in clinics. It is mostly used in acupuncture, and it is of top priority in Guasha therapy. Modern medical science believes that all nerves of internal organs derive from the spinal holes. These parts are the spinal nerves stretching into the nerves of internal organs. Both the Chinese medicine and the Western medicine scientifically believe its therapeutic effects. So the nip spine point is helpful. Another is Wei Zhong point. It is to scrape Wei Zhong point, which is in the middle behind the knee joint. For lumbago and acute gastroenteritis. It is widely used in clinics. These are special methods to cure special disorders. In the course of treating, we should combine common methods and special methods. Following the correct order is necessary. First, disinfect the skin. Then scrape gently, and then add force. The patient may bear with it. Some parts are not allowed to be scraped. Such as the abdomen and waist of a pregnant woman. Otherwise, unexpected injuries may occur. Also, the patient with blood disorder, say the reduction of blood platelet, and the patient with carbuncle and ulcers on the skin, should not use scraping therapy. Keep these in mind. Next are some examples of scraping. First, to relieve fever. It's common to get a fever. Scraping can reduce heat. Selecting some acupoints is necessary. First is Das Wei point, which is in Du channel, and is on the lower edge of the 7th neck vertebra. Disinfect the related parts. Use some Guasha oil. Scrape from upside to downside. Until red marks appear on the skin. Scrape towards both sides. Then outwards. After scraping Das Wei point, you scrape along Du channel and bladder channel. All selected points have something to do with reducing fever, such as lung point, Fengmen point. They all help to reduce heat. Lung point is 1.5 chun beside the 3rd breast vertebra. Fengmen point is on the top of lung point. Scrape upward on the 2 points in bladder channel. You can scrape Du channel vertically or horizontally. Five to 10 minutes is okay, until red marks appear on the skin. Don't scrape too hard. The patient can hardly bear with it. This may bring good effects for reducing heat. Also, Suchu point and Heigu point can be selected for treatment. The effect is good. Next is acute gastroenteritis, which is a commonly seen disorder. It has something to do with food and drinks, especially in summer because of bad food. The patient may suffer from vomiting, having diarrhea, stomach ache, and dehydration. In the course of treatment, select the points of Y Cheng point and Xi Zi point. Qi Zi point is selected by the horizontal line of the elbow. It is in the inner side of biceps brachii muscle. It is clear. If acute gastroenteritis occurs, veins can be seen clearly. While scraping this part, you may find some reddish, elevated patch of skin. It brings good results. Scrape along lung channel of hand Tai Yin. Red marks appear quickly. Scrape along the channel. Together with Tianqiu point, that is at 2 chun beside navel. The distance from the nipple to the middle line of the breast and abdomen is 4 chun, the middle of which is 2 chun. This is the stomach channel and brings good therapeutic effects in treating disorders of the stomach and intestines. The symptoms of acute gastroenteritis are vomiting, diarrhea, and pain in the stomach and intestines. To cure the disorder, scraping the Tianqiu point can bring good results. In clinics, according to the patient's condition, scrape one side or both sides. For heavy illnesses, we can scrape both sides. After scraping the right side, scrape the left side. First, disinfect the skin. Use a little Guasha oil. Both the inner sides of the upper and lower limbs. They are common parts in a clinic and are sensitive. After scraping, you may find some reddish parts on the skin. It is easily used and convenient. And brings good effects. Please note, the patient is not allowed to have a bath after his first day of treatment, for the skin is a little sensitive. And susceptible to infection. Next is the periarthritis of shoulder. Which is actually a degraded disorder. It is commonly seen among people around 50 years of age. The symptom of this disorder is pain with a stiff shoulder, especially at night. Guasha is a good therapy for addressing this issue. There's something that should be noticed. One painful point is at the short end of the biceps brachii muscle. The other is behind the deltoid. When one bends his arm, it aches clearly. The patient cannot bend his arm back and can hardly buckle his belt. This is a pain point. The patient feels pain when he holds up his arms. So when selecting points, one may choose Jian Yu point and Jian Liao point. When the patient holds up his arms, two concave lines can be seen. Its front concave line is Jian Liao point. These 2 points are pain points. They are also excited points for Guasha. The front side and rear side of deltoid are key points for Guasha. 3-hand yang channel is here. First, scrape part of the shoulders. Then scrape downward along 3-hand yang channel. Because the pain points are more than one, and 2 ends of muscles may feel pain, the scraped parts should be larger. Control the force according to the patient's condition. Less force may be used for the old and for the weak, while more force may be used for the strong. After the middle part is scraped, then scrape backwards. Some patients may feel pain in their back shoulder. This is because these muscles are all linked. You can scrape the Jianjing point downward. 5 to 6 minutes. Then change the scraped parts according to the patient's pain posture. If the patient feels pain when bending backward, then let him bend backward. Show the pain points that should be treated. In this way, better effects can be achieved. If the patient cannot pose like this, or the pain points are not clear, let the patient hold up his arms and show his pain points. And then bend backward. This is convenient for treating. In the course of scraping, let the patient move. Say the motion of lifting, push forward, or stretch backward. As the doctor scrapes, the patient is moving. Then scrape downward to elbow joints. In this way, better effects can be achieved. Guasha therapy is widely used in clinics and is very popular now. Guasha therapy can treat many disorders. The key for Guasha therapy is to select excited points, which are meridians and acupoints. Another is operating techniques, especially on some special parts. The Guasha techniques should be well mastered. Thus, its good therapeutic effects can be achieved. Moreover, you must know about what disorders can be cured by Guasha. Knowing about some acute disorders and complicated disorders, especially acute disorders, when the patient is treated by Guasha therapy, the instant therapeutic effects can be achieved. Practice it more in clinics to popularize Guasha therapy. Thank you.